You wouldn't run a business without data. You wouldn't make an important investment decision without research and information. Yet many women seeking to do their best and be their best are not given the testing they deserve in order to make sure that their health is on the right track. I'm Dr. Yvonne Karney. I'm the Hormone Locksmith. Did you know that the United States Preventative Services Task Force for women aged 45 only recommends a few screening tests? A lipid panel is recommended, a blood pressure, BMI, body mass index, and blood sugar only if you're obese. And that's it as far as blood testing goes. Sure, they recommend the colonoscopy and the pap smear and the mammogram, but all those are designed to catch disease. What if you want to stay healthy and be healthy? We need data. By the time you feel bad, so many things have gone wrong. You need to be able to keep up with things and know what's going on before you have symptoms. Because let's face it, many of us start to get these very subtle symptoms and we brush them off as, well, I'm tired, or I'm stressed, I didn't sleep well last night, or I'm 45, or I'm 50, or I'm 55. And if you're at a reasonable weight and you take reasonable care of yourself and you're reasonably successful in your career, guess what? Your doctor says, you're fine, you're normal, don't worry about it, because you're not sick like the rest of his or her patients are. But you deserve more than that, right? You're working hard, you're taking your supplements, you're listening to the podcast, you're trying to do the right thing, and you need more data. So today I'm going to give you 5 tests that I think are very important for longevity and performance and optimizing, and to keep ahead of the game, to make sure that you can detect problems before they show up. Because by the time they show up, so much water is under the bridge, you're playing catch up. So what are the 5 tests? Number 1, know your testosterone level. Testosterone is important for women. It's important for brain health, bone health, body composition, i.e. muscle development in response to exercise, sexual function, both libido and arousal. So it's so undervalued in women, and women actually have more testosterone than estrogen in their bodies, but it's not talked about very often. Now, if you're going to test testosterone, you need to know your total testosterone, your free testosterone, and your sex hormone binding globulin, because that is a hormone that grabs onto testosterone so that your cells can't use it. And guess what? Inflammation in your body increases sex hormone binding globulin. If that's high, that's a marker that you have underlying inflammation, and we should get to the root cause of that and fix it. Test number 2, hemoglobin A1C. This is a very important longevity marker. By the time you have elevated blood sugar, that's diabetes or prediabetes. And A1C is going to pick it up much faster because it's a marker of glycation, and glycation ages you quickly. Now, we run the hemoglobin A1C because it's a marker of what percent of hemoglobin in your body is glycated, meaning it has a sugar molecule attached to it. And because red blood cells live for about 3 months, it's a marker of how often over the past 3 months has your blood sugar been elevated. Now, you can have episodic blood sugar elevations without ever having a high fasting blood sugar. So if all you're doing is checking a fasting blood sugar, it's not enough. Now, certainly, if you wanted to kick it up a notch, then a continuous glucose monitor is excellent. But that's something that you would do on your own. I'm talking about tests that you would get from a doctor. So an A1C is very important. Test number 3 is actually several tests. It's micronutrients. Know your micronutrient levels. There are several that are particularly important. B12 is one. And many people are deficient in B12. It's not in a lot of our food sources. And even people who eat it or take a supplement sometimes cannot get it from their gut. It takes a lot of things happening in a row before you can absorb B12 through your food or through a supplement. So knowing your level is important. And please know that optimum is 700 to 900, not all the way down to 200, which is considered normal range. That is way too low. B12 is important for mood, for nervous system, for methylating, which is very important for your hormone replacement therapy, appropriate disposal of estrogen, and for just generalized detox. Methylation is a pathway that your body does detoxification. Another micronutrient that's super important is vitamin D. Vitamin D range is really broad, but optimum is 60 to 80 for most women. And if you had a history of cancer, you should be 80 to 100. Vitamin D is necessary for every single hormone in your body to work, and your immune system relies on it significantly. All we are taught to think about for vitamin D is bones, but it is so much more than that. The third micronutrient that you should be aware of is red blood cell magnesium. Now, why red blood cell? Because your body is very careful in keeping your serum magnesium in a very tight range because it's important for your heart function. If your electrolytes are off, then you can have cardiac arrhythmias. And so your body will steal from the intracellular component to keep the serum magnesium in this appropriate range. But guess what? Magnesium is the most commonly used tool in the toolbox that your intracellular enzymes need in order to get shit done. See, your intracellular enzymes are like the factory workers, and they're trying to assemble products and they're getting their jobs done. But if you ask your workers to do things without the appropriate tools, they're not going to be very productive. And magnesium is the most common tool. The fourth micronutrient is ferritin. Now, ferritin is the storage form of iron, and it's really a Goldilocks hormone. If you don't have enough, then your factory workers and your intracellular enzymes don't have the cofactors that they need to perform the important functions. If you have too much, you age quickly. It's like you rust. It causes oxidation, which is rapid aging. So the optimal for women would be around 60. Now, we'll take the range from 50 to 90 as appropriate, but 60 is really the target. Lastly, it's a relationship of a micronutrient of copper and zinc that is very important. Now, copper is important for growing blood vessels and for collagen formation. But if you have too much copper, it leads to a tendency towards anxiety because copper greases the rails to turn dopamine, a neurotransmitter of decision-making and reward, into norepinephrine, which is a neurotransmitter for the fight or flight response. How many women might have a little bit of anxiety and being told, oh, that's normal? Could it be related to high copper? Zinc is important because it balances copper. There's a little sponge in your body called metallothionein, and it soaks up extra copper when there's too much, and it releases copper when you need more. Every single one of those metallothionein molecules needs 7 zinc ions in order to make 1 metallothionein. So if you don't have enough zinc, you can't balance your copper. You have a copper to zinc imbalance, and you have high copper, and that leads to that tendency towards anxiety. This is super important if you're considering hormone replacement therapy, because there are some women who already have high copper, and because estrogen will increase copper more, and if you have a zinc deficiency, you're at higher risk for that. Those are the women that don't feel good on hormones. I wish I had known that 20 years ago when I first started prescribing hormones, because as a gynecologist, I'd be like, this woman needed hormones and yet she didn't feel good on them. What was going on? Now that I know what I know, I wish I would have checked a copper and a zinc ratio on these women, and I could have been able to correct it, therefore giving them the benefits of the hormones without having any risk of the mood problems that can sometimes happen. Okay, the fourth test may seem a little bit unusual if you're not having symptoms, but it's an ANA, which stands for anti-nuclear antibodies. This is a long-term health marker. We know that 80% of autoimmune disease is in women. We also know that a positive ANA precedes autoimmune disease by at least 10 years. So it's very possible that you could have something brewing under the surface and you're a go-getter. You're pushing through it. You're thinking, oh, I'm busy. I'm fine. I'm going to keep going. But if you have a positive ANA, that's a big red flag. The business as usual isn't going to cut it. And we need to do some deep work to figure out why your immune system is confused to build antibodies against your DNA. Lastly, you need something to evaluate cardiovascular risk. And I'm going to tell you, a lipid panel is not good enough. Cholesterol alone misses 50% of heart attacks. And you know what the first symptom of heart disease is? A heart attack. Heart disease is the number one killer of women over 50. So we want to get a handle on your risk of that earlier on. So there is a test called the NMR lipid profile, which gives you particle number and something called ApoB, which is very important. And elevations in either one of those are associated with an increased risk of heart disease. There's also a very advanced cardiovascular inflammation marker panel, because really inflammation is the key factor in heart disease and not cholesterol. So definitely an NMR, an advanced cardiovascular inflammation panel is even better, plus the NMR. Now in my next video, I'm going to go into a deeper dive on the heart disease question and the appropriate testing, including diving into the cardiovascular inflammation markers. I'm Dr. Yvonne Karney. I'm the hormone locksmith. I'm a gynecologist caring for women. I want you to be optimum, not just okay. And with the work that you're doing every day, you are needed, and we need you at your best. And you need to be able to have this data in order to know that what you're doing is working. So get these tests.